Alright everybody, Dr. Garrett Wegerif here at Pure Plastic Surgery for another episode of Thursday Thoughts. I hope everybody's doing well and having a good week. Just finished up a nice breast augmentation. I think one of the things that I would like to talk about today is anesthesia, what your expectations of anesthesia should be, the safety around anesthesia, and kind of just your expectations for the day when you come in for surgery. We get a lot of questions around this. So first of all, let's talk about the different types of anesthesia that we can do for procedures. One, and the least invasive one, is just local anesthetic. And this is similar to what you get at a dentist, where we're just injecting local anesthetic around the area where we're going to be doing a procedure. We use this very limited here at Pure Plastic Surgery because most of our procedures are a little larger. For very small procedures like very small scar revisions or something like that, it's a great option to be able to just do local. The next stage up is deep sedation, where you're getting medication that makes you very sleepy in a deep sedated state, but you're still breathing on your own and you don't have a breathing tube in. We don't use that as much here at Pure Plastic Surgery. The monitoring needs to be, you need to be monitored exceptionally well, and you can kind of go in and out of that deep sedative state. So when we're doing a larger case like a 360 lipo or a mommy makeover, we want you comfortable and asleep, nice and stable during the surgery so we can concentrate on doing our work without worrying about you really waking up or anything like that. So for the vast majority of the procedures we get here at Pure Plastic Surgery, they're under general anesthesia. What does that mean? That means you're actually induced for anesthesia, you go completely asleep, we put a small breathing tube in through your mouth, and that is breathing for you with the ventilator. How safe is this? General anesthesia over the last really 30 years, but even in the last 20 years, has become extraordinarily safe. If you are young and healthy, and you get all those clearances we make you do, you don't have any heart issues, the risk of you having an issue with anesthesia is probably, or a significant issue with anesthesia, is lower than the risk of you getting in your car and driving on I-95 down here in South Florida. It's extremely safe to go under general anesthesia, and you do really well with it for your surgeries because you're able to be completely asleep, not worry about anything. It's also easier for us, the surgeons, to do our job on these larger cases because we can just concentrate on getting your surgery done without worrying about, waking up, coming in and out of sedation and that kind of stuff. Is it possible to do some of these cases like liposuction under local anesthetic? It is, and there's a lot of people that do that down here, but I've done it myself a few times. It's much harder to do a thorough job when someone is not completely asleep and you're doing it under local anesthetic because it can be uncomfortable, even with the numbing medication in there. Sometimes you're just not able to get the results that you want. So anyone that has apprehensions about general anesthesia, I assure you it's going to be safe. You're going to be medically cleared before you ever get surgery here at our surgery center, and you're going to have a great experience from this. We work with a really great group of CRNAs who do these cases all day, and they do an exceptionally well job. On top of that, we, the surgeons, are monitoring your case the entire time, keeping an eye on things as well. With that being said, do we have any questions about anesthesia or expectations for the day of surgery, anything like that? Or any questions about plastic surgery?
If I got an ugly scar from a previous tummy tuck, can it be fixed?
Yes, it can typically be improved. We need to look at that scar to see what the issue is. Sometimes you had a previous tummy tuck and they pulled things too tight and that scar just became widened with time because they had too much tension on it, and that can definitely be improved because now that your tissues have had a chance to relax, it's just a scar revision, which we cut out the old scar and we reclose it. If you have another issue like a hypertrophic or a keloided scar, that's a little different. We do have options to improve that. But a keloided or a hypertrophic scar is one that's raised up above the boundaries of the scar. It's not just wide, it's actually raised up, humped up a little bit. And we can either do steroid injections for that to improve it. We can also use lasers to improve the pigmentation for that. And then other things, if we catch it early on, we can do things like silicone sheeting or silicone gel to improve a hypertrophic or a keloided scar. And sometimes if it was just done a long time ago, you had a keloid, and we tried some of those other methods, we can cut it out and start from scratch and do it again. But there is always a chance that a keloid will come back. But if we treat it aggressively up front, it shouldn't be too bad.
Is the recovery process for a drainless tummy tuck safer?
I wouldn't say the recovery process is safer or more dangerous for either of the two options. It's just a little bit more convenient for some people to have the drainless tummy tuck because they're not worrying about the drains coming out. They don't have the pulling and tugging of the drains. They're not monitoring the output. One of the things that is a little more labor intensive for the drainless tummy tuck is making sure you're getting those lymphatic massages, that whatever little bits of fluid are building up, we get that out with lymphatic massage and wearing the proper compression.
How long does a recovery process take for a tummy tuck?
So there's a few different phases of recovery. First phase is the immediate post-op period where you're easily able to get up and go around and do your activities of daily living. And that's usually 1 to 2 weeks for most patients. And that's just making it easier to get up out of a chair, you're able to drive again and that kind of stuff. In terms of getting back to the gym or rigorous physical activity, it's a minimum of 8 weeks because with our tummy tucks, we always do a muscular plication. And we really need that to heal in before you start getting too active. So that phase is about 8 weeks. And then the total recovery time, you're going to be seeing great results at 3 months from your tummy tuck, but that's not the final result. The final result really comes at about 1 year to 18 months when the scars have faded completely, and then you're no longer getting any really swelling in the lower part of your abdomen. So, there's the short phase that we need to get through, the slightly longer phase, and then for the absolute final result, it's about 1 year.
For out-of-town patients, how soon after a breast augmentation can we fly back home?
So the absolute minimum amount of time you need to stay here for a breast augmentation is 5 days after surgery. If you see me on the 5th day, you can technically fly out that night. I always prefer people give themselves a little bit more time and stay for at least a week after surgery, but 5 days is the absolute minimum.
Can I have a tummy tuck done with a large gallbladder scar?
You can, and I would love to examine that scar and see how long ago it was, but whenever we're talking about long gallbladder scar, that's a big scar, subcostal incision that cut through some of the blood supply that we rely on for your tummy tuck flap to heal. So depending on how low it is, how long ago it's been, we can do it, but you are at higher risk for having wound healing issues or blood supply issues if we're not able to get that entire scar out. If you had a lot of weight loss and you have that scar, sometimes I'm able to do a fleur-de-lis tummy tuck where I totally remove that scar and move the skin and fat forward, and then the blood supply is less of an issue. So send me some pictures, go to pureplasticsurgery.com to start the consultation process, and I'll give you a better idea about that.
How long would I need to stay in Miami in order to get a tummy tuck?
For a tummy tuck, again, it's about 7. So the total time, you need to come at least the day before for your pre-op appointment, the day of surgery, and then at very minimum 5 days after surgery. But especially for like a tummy tuck, I prefer a little bit longer. If you could say for 7 days, that's ideal.
How can I start a consultation, and can it be in person?
Absolutely. You would probably like to start the consultation process online, even if you're local, just to fill out some of the questionnaires and that kind of stuff. So you go to pureplasticsurgery.com. There's a little window on the bottom that you can start the consultation process. And if you're local, I would love to see you. We can always do in person. We can also do virtual consultations if you prefer.
Do you perform a transverse abdominoplasty with a scar on the breast for umbilical sagging?
Yes, we can do that. And that's especially, so what is that? It's a reverse tummy tuck, and this is coming into vogue a little bit more recently. And the traditional tummy tuck, we're pulling all the skin and fat down tight below. If your main issue is just skin laxity above the belly button, it is possible to actually make that scar underneath the folds of the breast and lift that part of the skin up. With that, we're not able to do the full muscular plication, so it's really just treating loose skin. And this is especially a good option for someone that's getting a breast lift at the same time, because you're going to have that same scar anyways. It's just going to be extended across the middle. So it's a great option for the right patient.
We got this question last week, but how can you make your belly buttons look natural?
Yeah, so again, for belly buttons, there's multiple different ways that's been described how to make a good belly button. For me, what I found to be the most natural looking is making a small shield style incision for the new opening for the belly button. But really what helps it is tacking it down to the deeper tissues so that the scar stays hidden within the crevice of the belly button and it's not as much out in the open. So I tack down my belly button to the muscle so it stays down deep and low and looks like a nice neat belly button.
Average cost for a mommy makeover?
That's different for every patient, so go to pureplasticsurgery.com to start the consultation process and we can get you a price fairly quick.
Do you think that people should get a lip lift at the same time as a nose job?
Yeah, that's definitely a possibility to do that. It depends what kind of rhinoplasty you're going to get, an open or closed, but it is possible to do both of those at the same time. All right, everybody, I appreciate you tuning in. I hope everybody has a great Friday and weekend, and I look forward to seeing you all next week.